traumatic experience. When I was on the phone with my mom, the last thing I told her was like, "Mom, I'm scared."
A 10-year-old was apparently one of 4 sisters being told to come out with their hands up in Surrey on Monday. What happened, why the family feels race was a factor, and what Surrey RCMP have to say about the incident.
At the executive level, we do have that representation, and we will continue with that representation.
The controversial municipal Surrey Police service is not active yet, though the chief constable says they're working on creating a diverse team. Just ahead, why some people are already criticizing the force.
The default speed limit in the city of Vancouver is 50 kilometers an hour on roads with no posted signs, but drivers beware, the city is making some changes.
Did I ask you what you have to say to Bonnie Henry?
Yeah, she can go herself.
An update tonight on a story CityNews first brought you last week. A 7-time Juno Award nominee no longer has a job at the Vancouver Symphony Orchestra School of Music. The school tells CityNews its relationship with jazz pianist John Stetch officially ended on Friday after it investigated him for violating COVID-19 public health orders. Stetch was seen on a February 20th live stream hosting a gathering of more than a dozen maskless conspiracy theorists at an apartment in Vancouver's West End. The 87-minute live stream was posted the following day on a Flat Earth YouTube channel.
My sisters and I went through a kind of traumatic experience. I think you're just so traumatized in the moment that, like, you're not even thinking whether or not they have guns. You don't care. You're just trying to keep yourself safe.
A family of 4 sisters in Surrey say they're traumatized after all of them, including the youngest one at 10 years old, were told by police to get out of their home with their hands up, with seemingly no explanation.
When I was on the phone with my mom, the last thing I told her was like, "Mom, I'm scared." And I put the phone down. But my sisters didn't hear that because in the moment, I'm just like, blocking out my feelings. It's just, this is about my sisters. I need to make sure that they're safe.
It happened Monday evening around 5 p.m. in Surrey. Blanche Monabeka says an officer came to her door and told her they had reports of a weapon in the area. Monabeka said they didn't know anything, and so the officer told her to go back inside. A short time later, Monabeka and her sisters heard a police officer yelling on a megaphone for everyone to come out with their hands up.
And we walked slowly. I told them, walk slowly, don't say anything. And I asked them, like, what's going on? Can someone please explain? Can someone tell me something? And no one wanted to tell us anything. They're just like, get behind the car, get behind the car.
Ultimately, the sisters, which included a 15-year-old and 10-year-old, were allowed to go back inside, all shaken. Monabeka says she was confused because their house has tenants in the basement, both Caucasian. She says police only spoke to them, but later never demanded they come out with their hands raised. Monabeka decided to share the experience through an Instagram video.
I don't think we can say that what we went through, like all RCMP are bad. It's specific RCMP.
Surrey RCMP confirmed Wednesday they were responding to a weapons complaint at the time. Corporal Eleanor Sturko says they are aware of the sisters' video and are looking into the matter.
We definitely are concerned with their concerns that they're raising, and what's happening at this time is that we already have had a senior officer that's reached out to that family. They'll be continuing to reach out to them. They'll be continuing to try to connect, and also we are going to be investigating their concerns and looking in. And we are currently doing a review of that file.
Dr. June Francis with the Hogan's Alley Society says she was horrified when she heard the story.
An apology will not do. We need now to take this as an example to make systemic changes and also to address how we will recover for those young people and for all the Black people, because it's a collective trauma.
Just be more aware of how you approach the situation.
In Surrey, Ashley Burr, City News.
We want to ensure that we have representation from the community in all ranks.
While the controversial Surrey Police Service is not active yet, the Chief Constable explains building a diverse force that represents the community is a top priority.
Diversity is very important for Surrey Police Service because of the community that we represent. So in looking at the deputy chiefs, we took applications from right across the country, And as you probably have seen, we have a female, we have an Indigenous person, and we have somebody with Japanese descent. And we have hired Superintendent Lav Manjet. He is from Surrey, born and raised, speaks the language. He is a very fine gentleman with a lot of experience in policing. And he is going to be in charge of our recruiting.
Chief Lipinski says the Surrey Police Service expects to have officers on the ground by the fall.
The RCMP have about 800. We're going to replace them, and then we're going to add to that each year. It's built into the budget because Surrey is growing, and you're going to need more police officers.
But criticism coming from Surrey City Councillor Jack Hundile, who says that diversity is not yet represented in the Surrey Police Service or the police board.
That board itself is not really diverse that you put together here in Surrey. On top of that, you have a police force that's being structurally built out right now with people in key leadership positions that really don't come from that diversity or represent Surrey as best as they could and should be.
Surrey City Councillor Mandeep Negra argues the Surrey Police Board is already diverse.
Province did a very good job in appointing that board members. They represent all the communities, all living in Surrey, and at the same time, and I'm very positive that Police Chief Norman Lipinski and his team will make sure of that when our Surrey Police Service is up and running, there is equal representation of all the communities in the Surrey Police Force.
In the months before the Surrey Police Service is up and running, SFU criminology professor Rob Gordon suggests an ethnic-based community-level approach.
One thing that they might want to consider is creating a community committee of some kind that deals with multi-ethnic issues and that actually works with the police.
With the fall launch just around the corner, Chief Lipinski says there's still time for input from residents.
Before we put boots on the ground is we're going to have community consultation. That's very important to me. Obviously a very diverse community, different needs from a policing perspective. I want to hear what those needs are.
In Surrey, Miranda Fatour, City News.
There are 542 new cases of COVID-19 across the province tonight, and 7 more people have died in the last day. More than half of the new cases counts are located in the Fraser Health region. There are 18 new confirmed variant cases. 246 people are currently in hospital, 64 are listed in intensive care, and nearly 290,000 doses of the vaccine have been administered so far. The next in-person briefing from Dr. Bonnie Henry is expected tomorrow afternoon at 2 o'clock. We'll carry it live on CityNews1130.com.
It makes a lot more sense in vaccinating everyone you can and then vaccinating the second dose when you get it, because that's how we end up saving lives.
More provinces are deciding not to follow the directions on COVID vaccines, extending the period between the first and second dose.
A woman is dead and her passenger is in hospital in critical condition after a head-on crash in North Vancouver last night. And police believe alcohol may have been a factor in the accident. It happened just after 11 o'clock on Low Level Road. Investigators say the vehicle was struck by another vehicle that appears to have crossed the center line. The male driver of that vehicle is still in hospital with serious but non-life-threatening injuries.
It's hard for this community to hear of these upsetting incidents, particularly the loss of life of a member of the community. Our hearts and thoughts and prayers are with her family and her friends today, and you know, we want to reassure the public that we take these incidents very seriously.
Anyone with information is asked to call police.
People zoom by here so fast.
Some people drive is so crazy, right?
I totally support that in residential neighborhoods.
The city of Vancouver has launched its first trial of a so-called slow zone for local streets in the Grandview Woodland area. That means drivers here in the pilot zone are expected to slow down to 30 kilometers an hour versus the usual default of 50.
I agree with it, although, you know, I'm a cyclist too, so you can easily go over 30K on your bike depending what street you're on.
As a driver, being told that you have to go slower, is that frustrating, or are you okay with that?
I'm okay with it. I mean, in city limits, people just pretend that they're driving on the highway sometimes.
It's driving a little bit fast. in this area and in this neighborhood.
Yeah, I think it's a problem.
It is an area where we've heard from residents and the community of concerns around, safety as it relates to, vehicle traffic. Speeds, volume.
Chow says the boundaries for this slow zone are Clark Drive, First Avenue, Commercial Drive, and Grandview Highway. Gateway signs, speed limit signs, and paint markings have also been posted to alert drivers of the change. But the changes have faced criticism that drivers tend to travel at speeds based on the street design, and that simply lowering limits just increases speeding tickets and becomes little more than a cash grab.
Grandview Woodland came out as a location where we felt that by installing signs without a lot of other interventions, it would still work, right? Because the way the street was currently designed, or the way it sort of felt and looked to drivers, that, it kind of felt natural as a 30-kilometer-an-hour street or neighborhood. There are others, of course, within Vancouver where we felt like installing 30-kilometer-an-hour signs and not doing anything else wouldn't actually achieve the results that we wanted.
I think it's a very good idea because this is lots of senior citizens.
Just walking, it seems to be dangerous.
Where I live, we actually have some street calming and they run up the alley all the time, and that's become a problem.
Access and parking in the neighborhood will not be affected, and a report on Vancouver's first slow zone is expected to make its way to council in the fall. In Vancouver, David Zura, City News.
BC Ferries is adding some new options for fares on its major routes between the Lower Mainland and Vancouver Island. As of today, travelers can buy a new Saver fare and a prepaid fare. The corporation says the Saver fare is its most affordable and is available on less busy sailings. The prepaid fare lets customers book and pay for their full travel in advance, saving time at check-in. Both are only available for advance purchase. New Westminster Council has voted to name the city's Q2Q ferry docks to commemorate the Komagata Maru. The city follows in the steps of others that have remembered the 1914 immigration tragedy. The Japanese steamship was carrying 376 Indian immigrants. It arrived off the coast of BC, only to be denied entry into Vancouver. When the immigrants were sent back, 19 were killed by gunfire and others were imprisoned. A family member of a victim says commemorating the tragedy makes sure something like it doesn't happen again. For the second straight year, the Cloverdale Rodeo will not be held on the Victoria Day weekend. It's been postponed because of the pandemic. Last year, the event was canceled entirely. Organizers are still hopeful the event can go ahead later this year, possibly in late summer or early fall. The hope is the rodeo can return to the Victoria Day long weekend next year.
I don't know what to do. I need mental health services right now. And they're like, there's nothing for us. We're so sorry.
She had multiple panic attacks after testing positive for COVID-19. Just ahead, one quarantined social worker says there need to be more mental health resources available specifically for those who get infected.
It makes a lot more sense in vaccinating everyone you can and then vaccinating the second dose when you get it, because that's how we end up saving lives.
Increasingly, more health experts are urging leaders not to follow the directions on COVID vaccines. In an effort to get more shots in arms, some provinces are extending the wait period for the second dose.
If we have 2 people, do we give the vaccine to 2 people and give them, greater than 90% effectiveness, or give one person who gets maybe 95% and the other person gets 0? Where's the equity in that?
The practice is in response to slower than expected vaccine deliveries. Some provinces like Quebec, Manitoba, BC, and Newfoundland extending the wait time for a second dose by up to 4 months, a move defying recommendations by drug manufacturers. But experts say those recommendations are based on limited testing.
The reason why it's 3 weeks and 4 weeks is because that's the testing that they did, but it doesn't mean necessarily that you couldn't have it at 6 weeks or 8 weeks.
Banerjee says the first COVID-19 vaccine given to a patient is meant to develop an immunity, while the second, or booster, acts as a reminder to the body of how to kill the virus. Waiting too long for the second, creating risks for the patient and vaccine supply.
At what point would that booster not be considered on time? And the normal public health practice is that you start again at shot 1 and then you do the booster. So that is the risk that perhaps that first shot is wasted.
While more provinces are looking at the practice as a possible way of speeding up herd immunity, the issue addressed by the Prime Minister, who stopped shy of endorsing it.
Obviously, we're seeing some of the science shift, some proposals put forward, which are very, very interesting, which could result in rapider timelines. But every step of the way, we're going to be informed by the experts, by science.
Late Wednesday afternoon, the National Committee on Immunization, following the advice of the experts, recommending extending the period between shots. According to the latest Health Canada numbers, 2.86% of the Canadian population has received at least one dose of a vaccine. In Ottawa, Nigel Newlove, City News.
No, there's nothing. You can call a suicide hotline. I'm like, but I'm not suicidal. I'm just having consistent panic attacks.
Nicole Shanker has been self-isolating in this downtown Vancouver hotel since she tested positive for COVID-19 on February 21st. When she got the call that she had tested positive, her mental well-being began to spiral.
And I started bawling my eyes out.
Shanker is a social worker who moved to Vancouver from Baltimore in August. A contact tracer told her she was exposed to a co-worker. Since her apartment lease was expiring quicker than her isolation period, a colleague from the States helped her find a hotel. She says she wasn't able to get the mental health support she needed from the contact tracers that called her.
At that point, I knew I had tested positive. I was on my 5th panic attack of the day, so scared. Because when you're coming from the States, it's like the news tells you, if you get COVID, you're going to die. So I'm panicking. My family's in the States. They're panicking. I was like, I don't know what to do. I need mental health services right now. And they're like, there's nothing. There's nothing for us. We're so sorry. I know people who were out for weeks. I know people who died from it. You just don't know. And that's absolutely terrifying.
Clinical counselor Dr. Natasha Ghosh says the response someone might have to a COVID diagnosis is rooted in the way humans developed.
When we think about the physiological response to something stressful, right, because that's what this is, our fight or flight system activates. So this system originally developed as, from an evolutionary perspective, run away from your saber-toothed tiger. But COVID-19 is the equivalent of that right now. So we're going to have the same response as we would to a physical danger as we are to having this someone telling us we have that diagnosis.
Then there's the added stigma of testing positive for COVID. You're afraid of getting it and the judgment you might face if you're infected.
So I think that stigma comes from that place of fear and the stories that we do see on the media all the time. We have this breaking news and our body is like, and it's reacting as if it's something new. But the breaking news is something that broke 20 minutes ago. But every single time we're having the same reaction to it.
The Ministry of Mental Health and Addictions says the province has invested $25 million since the beginning of the pandemic to expand online mental health services, low barrier counseling, and more online tools to help people assess their own mental health. They couldn't offer resources specifically for those who test positive for COVID-19 before broadcast.
But I think it'd be really amazing to get social workers on the team of contact tracers to just be on call, to be there because they know what to do.
In Vancouver, Keir Junos, City News. Vancouver's news is always available on the radio with News 1130 or online anytime at citynews1130.com. Your next edition of City News is tonight at 11. Thanks for watching. Have a great night.